so you can count them.
Hello, everyone, and welcome to another episode of Social Innovation Chat. This is where we meet with path-breaking social entrepreneurs from the Social Innovation Circle community and have a conversation with them on their innovative solutions for creating social change. I am Anshul Magotra, and today we have with us a member of the SIC community and a dear friend, Jagdeep Gambhir. Jagdeep is the founder and CEO of Karma Healthcare, which is an award-winning healthcare enterprise that is using the power of technology to provide equitable access to quality primary healthcare in rural India. Jagdeep, welcome to Social Innovation Chat, and thank you so much for joining us here today.
Thank you, Anshul. Thank you for having me.
So Jagdeep, why don't we begin with your journey? We would love to hear your backstory. What did you do? What was life before you jumped into the field of social entrepreneurship?
Yeah. So I mean, mine is fairly an accidental journey. So I'll probably just share about this in a minute. So I am a computer engineer by training. Went to NIT Surathkal, which is a engineering college in India. Then joined Goldman Sachs on the technology side, where I was building software applications for anti-money laundering compliance. But have been always wanted to work at the intersection of technology and social impact. So quit my job in Goldman and went into rural Bihar, where I worked in providing tuberculosis treatment to people in rural Bihar. Spent about 18 months, in a village, in rural Bihar, kind of looking at healthcare challenges on the grassroots. Then did my, business school degree, and then, joined and started Karma Healthcare. Yeah. So that's a bit about me.
Okay. And in that journey, I mean, was there a pivoting moment or an aha moment, which made you realize that this is what you needed to do, that this is the mission you wanted to focus on, and which ultimately led to the birth of Karma?
Correct. Yeah. So again, Anshul, I mean, I, when I kind of before I moved to rural Bihar, from Goldman, right, or when I was actually moving to Bihar, I was not really too much inclined on the social side. The move was predominantly dominated by kind of the opportunity, and the role that I saw at that time was interesting. So I did not have the notion to change the world, right? And when I kind of plunge, as soon as I kind of the names of villages, right, where we kind of currently operate, or the areas I not even heard of them. But when I actually interacted with people, looked at the situation of how difficult the challenge of access to healthcare was. At one time, I felt a bit ashamed as well, because on one hand we have in India, which is kind of the word beater, but on the other hand, we have the challenges like healthcare, right, access, to very basic healthcare. That's when I decided that I'll probably try to use my time and skills, right, related to that. And since then, kind of have been directly involved, in healthcare related, development sector related things. Yeah.
And that's really very interesting, Jagdeep. And it's definitely not an easy thing to do, switching gears and actually making an absolute 180. It requires a lot of courage. I mean, I myself have shifted careers. I started my career in banking and then moved to the social sector. I mean, in retrospect, it has been fantastic. But at that point in time, it's not an easy decision to take, when you're in the middle of it. So really well done for having that gumption to make the switch and making this cause your life's purpose. So before we dive into discussing Karma, so for the audience that is watching us from all over, could you share a bit more on the Indian healthcare landscape? What are some of the biggest challenges that you see in healthcare in India, and what are the complexities or some peculiarities around it that make solutions difficult to implement?
Sure. Yeah. So I mean, I'll probably state some numbers here, right? So about 700 million people live in rural and semi-urban India, right? So I mean, from the amount of scale of the population, that's 700. It's a very, very large number, right? If you look at the number of doctors which are there in India, currently number of practicing doctors, India probably has, about 1/6 the number of doctors it currently needs. I mean, the doctors will be more, but some of them are not practicing, some of them move to another parts, right? But about practicing doctors will be 1/6 the number of doctors, and most of these doctors are in the top 20 cities, right? So the question is, what happens to the 700 million people who are not in the cities, who live in rural and semi-urban India, right? Given the acute shortage of doctors, most of these people actually seek care from an informal provider who they believe is a doctor, because he or she is branded or marketed like that, but is actually an informal provider. You do not get a prescription. The guy or the person has limited or no medical training, right? And they end up paying out-of-pocket expenditure. So there is obviously no insurance in most of the cases. 59% of the health insurance of the expenditure in India is out of pocket, right? So compared to some of the other countries, that's a very, very large out-of-pocket expenditure that does. And people, as I mentioned, seek care from an informal provider. They typically get a mocktail of steroids and antibiotics because these are people want quick relief, and you probably overprescribe to treat the person better, but has long-term implications on the healthcare system. And there is absolutely or very limited choice. You could then argue that people could go to a government facility. There is obviously a lot of government and public health system available in rural India, but about only 30% of people are seeking care from a public provider in that sense, right? And it's also another stat related to the funding, right? India spends from the public health point of view, spends about 1.5% of its GDP on healthcare. Compare that to with some of the other developed countries, that's about 8%, which in Australia is spending. So that's a massive difference, right, on healthcare expenditures. So even if the government was to double its funding, it will still be short, right, to what it requires. So, overall, I think what I'm trying to say is that there is a large private sector play as well, whether philanthropic, whether commercial sustainability, and lots to be done by the private sector as well. We can't leave everything only to the government, is what I'm trying to say.
Right, absolutely. No, thank you for giving that perspective, because it clearly throws a lot of light on the sheer size and scale of the problem, the complexities around it, and the severity and the social costs that emerge as a result of such a massive problem. So, I think if you can just share more about Karma, what you do at Karma, we would love to hear that.
Yeah. So again, our mission is how do you improve access to care, right? And when we say access, there are three aspects, right? How do you improve availability of care? So, is there a health provider or health service nearer to your home or place of work? Is it quality? So the second aspect is that, whatever health service you are getting, does it have quality? And the third is affordability. So at Karma, our goal is to improve access to care. Largely what we do is follow a nurse-assisted telemedicine clinic. We open clinics in rural India. Typically, a clinic is serving a population of 15 to 25,000 people, right? It's a physical clinic. There is a nurse or a paramedical staff who is facilitating video consultation between patients and the doctor is remotely available, over a virtual system, over a large TV screen. But we are an end-to-end primary care provider. So we provide diagnostic services, medicines, consultation services, referral. We do a lot of outreach and awareness work that we do, with this. Again, our focus is, we are an impact-first organization. So the focus is that how do you improve access, thereby creating large-scale impact, at Karma.
Right. So, obviously it's a telemedicine-based model that you run, right? But telemedicine as a concept is definitely not new. There have been many ventures that have worked on this, even in India. So what is different about your model, Jagdeep, as compared to others in the same space? Or in other words, is there anything different that you do which has played a very critical role in your success?
Yeah, well, I mean, 2-3 things, right? That I think kind of is something that we kind of strongly believe in, and is kind of also reflected in the operating model. One is assisted care, right? So when people talk about telemedicine, there are a lot of there is another operating model which is handheld mobile. So you use a mobile phone or a smartphone or even a telecall to talk to a doctor virtually. Our focus is more on the assisted care. So ours is a physical setup where you kind of do that. And we strongly believe that having a person, especially in a context of rural India where we are talking, there are language issues, there are dialect issues, there are, other social issues, determinants of health as well. Having a person who can be with the patient, having a nurse who can also provide more clinical information to a doctor is critical for ours. So, it's kind of a phygital model, right, which is there. So it's kind of backbone is technology, but the front end is a physical, layer. The second is that ours is not a franchise model. So these clinics are, kind of in a way 100% controlled by us from an operating standpoint, right? So this gives us, better control on the quality and the health outcomes that we are able to do. And then, that is something we have kind of taken a call that, again, being an impact first, you have to have, ensure, that the quality of care that is provided, is also kind of there. And the third is, we are an end-to-end provider. So we do everything, right, which is related to healthcare. It is not only a teleconsult, as I mentioned earlier, it is a spectrum of, care, which is a patient walking into a clinic, is seeking care, for a combination of some of those things.
And how do you provide those other services? So of course, for the diagnosis, for the consultation, there is the clinic, a physical clinic, and you have a nurse. But what about the other services like diagnostics, medications? How do you provide those services? Do you tie up with other partners? How is that run?
So in many cases, we have our own pharmacy, or we operate a clinic which is fairly, next to a pharmacy, right? But any clinic, you will have a pharmacy within 50 meters, right, of where we operate. And for diagnostics as well, because we tend to open clinics in clusters, we would partner with the local health, diagnostic lab, right, ask them for subsidized discounts rate, bulk rates, and provide them for our patients. So there is a sample collection which is done, and then the patients, get the reports online.
Okay, and Jagdeep, I would like to go back to the first point you mentioned, which is about the the nurse-assisted model and really what makes that so special. And are these nurses from the communities where the clinics are located? Because you mentioned that, of course, having that human interface is necessary to build that trust, and also it works for the doctors because then the information collected is a lot more legitimate, and the vitals can be taken, proper information can be taken from the patients, and it also helps in overcoming, I guess, some of the language and social and cultural barriers that you would otherwise encounter. So is there anything special that goes into the selection and training of these nurses? Are they from the communities itself where you locate these clinics?
Yeah, so they are, as right, I mean, in India, right, the dialect will change every 50 kilometers, right? So if you hire a nurse, right, from a different state, while they can still communicate for sure, but when a person is sick, right, you need compassion and trust, right, and I think that human interaction is, greatly enhanced by having a local person, that somebody who also outside the clinic, right? You might actually meet at a social function, later on, right? So most of 70% of our nurses are women, right? So that also kind of helps, because there are certain gynecological issues which women will be more comfortable speaking to a female, or a women nurse. So that happens, and they are all from a local context as well. Again, when we look at care, and trust, while all this is technology, but the meat of this is actually a social interaction that a patient and the nurse is having, or a patient and the doctor is having. So speaking 2-3 lines of trust, speaking it's okay, you will be all right. I think sometimes these words itself, it's healing, right? It's sometimes we think that it's only digital care, but it's also healing process that kind of happens, right? So yeah, so that's where I think it's a fairly localized operation, if that is there.
Those are some amazing nuances you've touched, right? I mean, you cannot forget the human aspect of this, no matter how much of technology you bring into this. And I believe these nurses would also kind of become your ambassadors within the community because there is that element of trust and people know them. So yeah.
For the people, the nurse is the doctor, right? I'm actually sitting in a clinic right now, and we were discussing, and the patient clearly said that if she's on leave, I don't come, right? So for the eyes of the customer, they are they actually that interaction with the nurse is basically, it's the role shift that is making the model fruitful.
That's very, very interesting, and thanks for sharing that. So Jagdeep, we met for the first time in 2016, and Karma was quite new at that time, and certainly you've come a long way since then. So tell us more about where Karma is now. Like, what has been your impact journey in all these years?
Yeah, so I think, Anshul, I think once we met, I think we were 3 clinics, right? So we currently have about 25 clinics. We now in 4 states that we operate. In terms of numbers, I think we have, from a clinical consultation point of view, we have treated more than 200,000 patients. These are paid consults that have happened on the platform. We also provide our technology platform to our partners who use our technology, doctors and other quality assurance networks. If you calculate all of that, we have been able to touch about 2 million lives directly, through our work. So that's kind of on the numbers piece. But when we look at impact, it's also good to measure the health outcomes or impact from some of the other elements as well. And we recently conducted some external evaluations of our work to see that, okay, at a micro level or at a clinic level, is a clinic like ours creating an impact, right? And I'll probably share 2-3 numbers, right? From a health outcome perspective, in a randomized controlled trial where our clinic was versus where it is when the clinic was not there, 20% reduction in percentage of children who were underweight, right, also kind of correlated to malnutrition, has been found in the clinical survey. That's on the health outcome side. On the impact side, because on the economic impact side, when you look at is there a benefit of having a clinic close to you? Affordability, as I mentioned, on an average, people have reported savings of at least rupees 500, right, or about $12 per visit. That every visit to our clinic has reported. We do a lot of quality assurance and quality work as well. 95% of the prescriptions that we had were validated for best practices for public health quality, and we kind of scored 95%. So again, that means that the quality of care that we are providing is there, and 90% of women actually reported an improvement in their health income in medium term after coming to the clinic. So we reported it after 6 months, and 90% said that, okay, yes, I went to that clinic and I have had this thing. So these are some of the numbers as well, not just the transactions, but the impact numbers of our work. Yeah. And I'll share one story because it probably compile this thing. So a patient, change the name. Let's say her name is Parul, right? She's 26 years old in a place called Gilund, about 120 kilometers from Udaipur. She came to our clinic. She was married for 7 years and I was unable to conceive. And she, she spoke to our female nurse and said that, if I don't, if I'm unable to conceive, my husband will marry somebody else, right? And I will be, it will be, that's what happens in socially in many communities. So our doctor, and she had went to many hospitals before that. So our doctor, said that okay, let for basic primary infertility. She took life-changing experience that as soon as her she was discharged from the hospital, She took a train and met the doctor, which was consulting her 400 kilometers away. And, and she literally basically, told the doctor that, I am, one big stress, right, and catastrophe, right, that could have happened, was saved. So, again, it just comprises of a more human element of how our work at a community level could impact, not just numbers, but also, human lives, right?
Yeah. No, absolutely. That's really powerful, because that is when you know that is like that you're doing something right?
Yeah.
When you're bringing about meaningful change, which numbers and data may not always capture. So that's incredible. And what is next for Karma then? So what do the next 5 years look like, or you want should look like?
Yeah, again, see, so our, again, COVID has also, the last 2 years has been COVID, some changes here and there. But again, our focus has been, to kind of scale up the e-doctor clinic model, the nurse-assisted clinic model. We plan to go to about 100 clinics, right, in the next 2 to 3 years, right. Also create a commercially sustainable model around it, right. That is a model, so impact is great, but how do you actually, financially sustain is also an interesting question, right, that we are kind of trying to, look at it. Therefore, so while we will geographically scale, but there are lots of focus on actually making our care more comprehensive, including referral systems, right, linking with, the tertiary care hospitals, secondary care hospitals, making healthcare more digital, more comprehensive, and also adding more value, which then will ultimately be monetized, to the patients. There'll be a lot of focus on value-added services, as we call treatment for non-communicable diseases, as the disease burden, shifting, also financing of health. So, can you actually go more insurance but lots of exciting stuff. The goal is that, can you prove at scale that a model, which is, nurse assisted primary care model will work. And if you are able to prove that, then scalability, impact, is probably not in doubt. But, once we kind of prove the commercial viability part, then, I think we would have really, created something, which can be massively scaled. Yeah.
Right. That's interesting, because I mean, as a social enterprise, you have to constantly balance, the delivery of impact with financial sustainability. And as you said, that in this sector and geography that you play in, because of the sheer size of the problem and the way you are located, if you crack the model, impact is not that big an issue. You will, get people to benefit from what you do. But how do you go about creating that level of financial sustainability to then scale and deliver more impact? So yeah, absolutely. So just shifting gears a bit, Jagdeep, because I want to talk to you a bit about fundraising as well. But before I move on to your experience, could you share what you see as some of the biggest gaps in financing healthcare in India?
Yeah, so I think, healthcare is a complicated subject, right? I think, when you look at healthcare, it means different things, to different people. So I think when we look at, from our point of view, we believe that, having more blended finance options are, they are coming up, but, currently, equity is one way people kind of look at it. Grant is another way, but, having more blended solutions probably are the way to go for healthcare. And, that is something which is coming out, is still early stage. The other thing, from an enterprise standpoint, is that we see a lot of funding activity happening for, kind of, early stage ventures, or very large scale ventures, but there is a gap in the middle, right, where we, typically an organization which is more than 5 years, less than 10 years will kind of fall into. So that is, I think, a gap that needs to be kind of fixed, in the ecosystem per se.
And you fall into that bracket, right? It's 5 to 10 years is where you are. So how have you set up yourself, to overcome those gaps? Because you have raised a considerable amount of funding and from highly credible funders. So how have you played in that space?
Yes, I mean, it's not easy, right? And, I think the way we kind of look at it is that I think we quickly realize that, the market that we operate presents a large scale commercial value, but also has to be balanced with social impact, right? So we therefore I think over time become a little more smarter about using the right set of capital for the right set of activities, right? So there are certain activities from our work which are just not commercially viable, right? Let's say an awareness about COVID, right, in that sense, right? So we have therefore used some grant money for that. There are certain set of activities which are very commercial, right, value added, right? So we kind of look at certain where we probably use debt as well. So our mantra has been that, okay, we look at our total financing requirement and see, okay, because we are delivering impact and value from a healthy impact as well as an economic impact, so to see which is the right kind of capital, and that is what we have been able to kind of look at that.
That's very interesting, because that's exactly what we also talk about in social innovation circle, which is really social enterprises should focus on raising the right type of capital for the right part of their organization from the right funders, and probably even at the right time, right? Because it's timing related as well. So absolutely, I mean, this is great validation.
Correct. Yeah.
Okay, so moving on, well, Jagdeep, I guess, there's no healthcare related discussion that seems complete without really touching on the COVID pandemic, right? So what do you think has shifted or changed as a result of that? And, any challenges that have come to light, or for that matter, any breakthroughs that have come about, because this has been on top of everyone's mind for more than 2 years now?
Yeah, so I think one of the good things we kind of the positive things that has happened because of COVID is that it has kind of made some of the regulations around telemedicine much more clearer, right? So earlier there was a lot of gray area, and we had to kind of, while we knew we were doing the right things, but there was some do these things, some fall completely on the legal side, right, because the laws were made 70, 80 years ago. That has now shifted. There is obviously more acceptance of digital care, right, onto that. So that has happened. And I think people have now realized that there is much more, a focus on primary care, right? Because COVID has taught us that, we cannot always just rely on tertiary care. So there is more focus on primary care. There is more focus on creating models for primary care, which is, kind of music to our ears, because that's what we have been doing, right? So that is what we think. And certain policies, like in India specifically, like the National Digital Health Mission, right, will actually now go a long way to kind of create an ecosystem on digital health, where models like ours could now, digitally communicate with some of the other agencies, right, and create more value.
Okay, so something good has come out of this. So that's good to hear.
Yeah.
Okay, fantastic. So we are nearing the end of this chat, but before we wrap up, I want to ask you about, what has been your biggest learning in this journey, and feel free to share at a personal level as well. I think it's really important for everyone, including, budding social entrepreneurs, to understand that and really appreciate the personal aspect or struggles that are involved. So what have been your biggest learnings in the last 7 to 8
I
years?
think, first is, I think resilience, right? I think, it is sometimes, any entrepreneurship is a fairly lonely and a scary journey, right? But I think, being true to the cause, understanding that, whatever we are trying to create, is adding value, right, to the customer, in his or her life, right, and being resilient about that is I think one of one key thing. The other is that I have personally created and kind of actively sought to connect with like-minded people who are in the social impacts in entrepreneurship space. Social Innovation Circle, you guys, we have been talking for many years, and your contributions to Karma, which you guys might not know, but whether it is just bouncing off ideas, connecting with potential funders, right, or just validating that we are on the that there is a journey, that we are all onto that. So reaching out for help, because it is a lonely journey, and I think as I see as well, but actively, that is something that I have to reached out to, which is important. And the third is mission alignment, right? in a COVID related world, when digital health, March 2020, it just kind of took off. We got offers from many of our from people we know that, let's just pivot, let's just, this is the moment, of digital health. Let's, move to a completely commercial model. Let's close the clinics, use our software of tele medicine, and provide healthcare to even Western and other mature markets. But we said no, right? And we said that we have been born with a mission to provide care. That work is still not complete, and we declined fairly lucrative commercial opportunities to focus on our mission. And I think my key learning or takeaway is that I think alignment to the mission, right, is something that everyone needs to kind of especially in a social entrepreneurship kind of a setup is critical.
Yeah. No, absolutely. I mean, I have known you for more than 7 years now, and I can definitely vouch for that. The level of resilience and determination that you've shown in this journey through all the highs and lows and some of the lowest of lows. It's truly exemplary. And what you say about keeping your focus on the mission and really making your mission your North Star is absolutely spot on, because it is a very challenging path indeed. And the only thing that will keep you going is that single-minded focus and determination to deliver that mission. So really, job well done. So Jagdeep, how can people learn more about your work or support you? What is the best way?
No, so I mean, we are fairly, active on LinkedIn, right? So I think that's, if somebody, from the audience wants to connect, right? Just ping us, on LinkedIn or an email. That's probably, the way to go for us. So there is obviously a website where people can learn more about it. We don't update it as much, right? But I think LinkedIn, is probably the best way to connect, and then we can take the conversation from there on.
Fantastic. Well, Jagdeep, thank you so much for joining us and sharing your story with all of us today. So on behalf of Social Innovation Circle, I just want to wish you and the entire team of Karma the very best as you continue to diligently work on your mission of transforming healthcare in India. So thank you so much for joining us today.
Sure. Thank you, Anshuman. Thank you so much.